his dental training and received his DMD in 2005 from the dental school at the University of Erlangen, Nuremberg in Germany. In 2010, he completed his medical education at the medical school of the same university, receiving his MD. Was appointed consultant and senior physician for maxillofacial surgery at the University of Göttingen in January 2016, where he still teaches up to date. With his father and brother, maintains a private office for dentistry and oral and maxillofacial surgery in Ansbach, Bavaria, Germany, and he also directs the department for oral and maxillofacial surgery at the hospitals of Ansbach and Fürth. In November 2016, he was elected director of the APW, the Academy for Postgraduate Continuous Education of the German Dental Association. He lectures and publishes internationally and nationally on several topics and is the main author of the augmentation guideline paper of the Consensus Conference of the German Society of Implantology, DGI, which will be published in 2020. Dr. Tröltzsch, on behalf of Bego Implant Systems, I would like to thank you very much for accepting the invitation for this interview.
Thanks for having me and inviting me.
I would like to start asking, how do you educate and motivate your team to face this new era of dentistry without fear?
Well, you're going directly into the topic and maybe into one of the hardest parts of the whole game. The team is the core factor for us to work. And allow me two statements before I begin. Number one, I take this disease extremely seriously. And second, Germany did not close down dental offices, so we were working through the pandemic. So we accumulated some experience now how to deal with that. And allow me to state some things before we go into that. I'll introduce my brother and me because we're in this all together. And to the left is my brother, to the right is me. And as you already were so kind to mention, we're both maxillofacial surgeons and we also work as dentists. Now, this is the office back home. It's been founded for more than 75 years. It's been active for more than 75 years now. To the right is my dad. To the left is the dental office. And his dad started the business. We're both oral maxillofacial surgeons, and we're mainly focused on patients that have diseases that are not healthy, and we're looking especially into augmentation and implant surgery for these patients. Now, as you asked the first question, how do we lead and motivate our team? Now, the first thing we stated with our team, and we started in March, that there won't be a time without COVID-19 anymore. So that's a virus that's here to stay. And we published that at the end of March, basically, the statements we prepared just for the office. We published them openly for everybody to get access to that. And this is how our team moves in the office 24/7. They always wear masks, goggles, and caps for their own protection. And we also trained them with a special guide how they should wear them, how they can dispose of that, as we also face a mask shortage as so many around the globe, right? Everywhere where you see that green hook, the data is provided for download from our website. So everybody who watched this webinar can also get these guides from our website. I'll show you where later. This is our hygiene rules, and they were also installed partly to protect our team. So we do telephone triage the day before we see a patient. Everybody has to wear masks and gloves all the time. So this is mainly for our own protection, right? And I'm very happy that some ingenious colleagues like Dr. Smulders and Dr. Lozada translated these rules into several different languages like Dutch and Spanish. So an important question always was, how dangerous is that for us? And there is studies that show us that aerosols in experimental settings can pose a hazard. However, if we look into settings that come from clinical life, the studies show decisively that droplets is the issues and that aerosols that were caught from patients that are COVID-19 positive do not show infectious signs of the virus, as you can see in these two amazing and important studies. So the masks are crucial for us for our own protection.
And you didn't close the office during this whole period. Your family always kept the office open during this whole period, correct?
Absolutely correct.
It seems that the patients are still afraid to return to dental clinics for treatments that are not emergencies. How can they regain the confidence of going to their dentist?
Well, that's a crucial part, I guess, all over the world right now, especially in countries where dental offices were closed down due to the risk. Everybody knows that the disease is not gone. So why shouldn't it be risky to go to the dentist now? And here's one of the most important and most critical parts about closing dentists down. You need to have really a strong reason to do that. And from our aspect, what the science shows and from what our German health authorities saw, there's absolutely no reason for that because you destroy so much confidence. Actually, dentists are superstars of hygiene and they have always been very, very safe towards their own patients. And that hasn't changed during the pandemic. So I'll have some more slides on that, like how do we guide our patients, right? It's very important to know, and I'll come to that later again, that our standard disinfection works great, but also that it is beneficial that the patient rinses with 1% hydrogen peroxide for 1 minute prior to any treatment to eliminate the virus. So with that, we show, okay, we take special measures. We also established a guide for masks that people, our patients, can wear in civil life, how they correctly use them, how they apply them. So patients also wear masks in our office and until we start the treatment, right? And also this was again by some great dentists translated into several languages. So it's very important to have certain measures that are demonstrated, but also to tell the patients from the beginning on, we're safe, we know how to do our hygiene, and we'll protect you. So also we made the stream of patients through the office a lot slower. So we see less patients and we have a special disinfecting station where they come into the office. So the first thing is they disinfect their hands. And also we call every patient the day before the appointment to make sure they're healthy and also ask whether there's any concerns and address them directly.
Yeah, that would be the question. Now, let's say patient now who will restart the treatment, for example, patient that plan to come for an implant surgery or will return for a prosthetic treatment. How does your staffing is proceeding before the appointment? Let's say 1 day before the visit of the patient to the clinic. As you said, they call the patient. Uh, Something else that you can tell us?
Well, calling the patient is very important because there you can directly address the concerns. Furthermore, it depends on the risk factors each patient carries when we treat them. So if we have patients who have severe risk factors, we will isolate them and we will see them in special operatories that are isolated from the office, uh, which has a special entrance so that they do not get in contact with anybody at all. And we tell them before that and thus time their treatments so that it's safe for them to come.
So let's say now the patient arrives at the clinic. How does the waiting room looks like for him, her? This is different from February 2020. What is the protocol from the moment the patient arrives at the clinic until the patient sits in the chair for a clinical procedure?
It's absolutely different. So we don't have that many patients anymore in the waiting room. We took out many chairs so that every patient has a space of at least 2 meters around them. We make them wear masks in the waiting room. We removed everything from magazines to books, everything that they touch. We added a hand sanitizing station so that they clean their hands before they enter, and we keep the waiting times extremely low. And if we have more than 1 or 2 patients waiting, we send them away, take their cell phone number, and call them back into the office as soon as the time is there to direct them directly into the operatory. So we try, which is not possible all times, but we try to use our waiting room as little as possible or not at all at the moment. The whole thing is centered on avoiding people getting too close to each other. As we know, the droplets emitting by coughing, sneezing, and speaking are the main source of infection.
The patient now is sitting on the chair. So before starting an interview, as you said, the special procedure with hydrogen peroxide, but any other special procedure or telling us again about the mouthwashing with the specific agent to reduce the spread of microorganisms, pathogenic or not?
Yeah. The most important thing is we always work exactly like this, as you can see it here right now. We never even approach a patient without mask, goggles, and cap. And I think that is the most important part of the whole game, to make sure yourself don't become a source of cross-infection. Now, the mouthwash is very important. The patient wears the mask as long as we just talk in the chair. And furthermore, we do everything we can to reduce the time spent with the patient, right? We know from the literature that it's droplets transmitting it. We think it's not aerosols. We think it's not airborne. But as I said, we think. The literature is not 100% clear here. As showed before, in lab experimental settings, airborne transmission is possible. In clinical trials, as far as we already have them, it's not possible. So we still have to be a little bit careful here. So mouthwash, mask, we ventilate our rooms all the time as much as possible. I'll have a look into that a little later also, as we know that fresh air is very beneficial. We reduce the time spent with the patient as much as possible, and we try to perform treatments that cause as little spray as possible, but we'll go into the question of spray and aerosols a little later.
And once again, just to repeat for the audience, the protocol of the mouthwash, please.
It's 1% hydrogen peroxide for 1 minute. So the literature says 0.5% is enough. We'll just have 1% as it's also easier to prepare. The taste is awful for the patients. We pre-inform the patient that it's recommended and necessary, and everybody goes with us through that.
Okay, thank you very much. And have you taken any special measures since the beginning of the COVID-19 crisis to reduce the impact of the aerosol, we talked about it, produced during the clinical procedures?
Allow me to share my screen again, as this is a very important question. Now, the whole media is full of the term dental aerosols. And here's the first mistake. We don't produce aerosols, we produce water spray. We produce water spray that in a very, very high dilution also contains parts of saliva, parts of even mucosa particles, and also particles of pathogens. And we know we're talking droplets, right? We know it's a virus that goes through the mucosa of nose and larynx and maybe eyes. So we have to be very careful with our protective gear. So we need goggles. It's furthermore very important to state that it's not a new virus. We're not facing the new super virus that's resistant to everything and a super killer. It's totally not. It's not resistant to everything. It's absolutely susceptible to our standard disinfection and sterilization, and it's been researched since the 1930s. So there's nothing truly new about the virus, but that it's a very aggressive kind of it. And as said already, it's very, very, very serious and very important to take that disease that's caused by that special virus seriously. So, and we know when we look into the wards of the fever clinics, that around the patients, both in air and on the floor, we can have RNA virus samples. We don't know if they're infectious, and we know from these fever wards that our standard PPE protect ourselves against that. And there's this famous study from a restaurant in Wuhan that also showed that the droplets emitted by a person can actually be derived with the flow of the air for another meter or two and transmitted like 2 or 3, maybe 4 meters away from that patient. So as the WHO stated, airborne transmission is not reported, but still we know our splatter is aggressive. So we set up an experiment how to analyze this splatter. Here's a very, very important paper that actually a sufficient high volume suction reduces the risk emitted by more than 90%. And with these two amazing gentlemen, Howie and Tommy, we went into setting up an experiment. And here you can see the water spray coming from a regular dental handpiece, red one, and you see loads of water spray coming up into the air. And now when I cut the water supply, you see how long those droplets take to rain down. They rain down forever, right? Same experiment, we started again, but now we add in some suction. It comes from the right corner, and as you can see where the suction is, the droplets are gone, but where it isn't, they still rain down. So third experiment, suction and handpiece, and suction is active from the beginning on, and you can see how the droplets are sucked into the high volume suction piece. First the big droplets and then the small droplets, and you see how that water spray fountain that's nearly a meter high is reduced to 10-15 centimeters maybe. And most important, when I cut the water supply, no drops, everything sucked away. And when we transfer that to the intraoral setting, you can see how sharp and crisp that airflow, that water flow is from the handpiece, and how foggy everything is when the suction is not active. So in a direct comparison, we can see how efficient our suction is if handled correctly. And if we also apply indicators to our face shield, we can see that with an active suction, nearly no humidity or no humidity comes to our faces. Now, when we perform surgery, that's my regular surgical setup also during the pandemic, right? When we perform surgery, we use surgical handpieces. And here you can see that the droplets are totally different. They're a lot bigger. The whole fountain goes up 25 centimeters, or maybe a third, maybe a fourth of the other aerosols, right? So the whole thing is when we go into digital surgery, like here you can see a digital augmentation case that was prepared where we raised the bone under the 3D titanium mesh, and here you can see the BEGO guided implant system that helped us a lot to reduce the time spent with the patient. So where we can use digital supported measures, it helps a lot. Louisa, she works with me. She is the genius that worked into these slides as well. So what can we learn from this? We don't know whether aerosols spread the virus. There is a slight risk, that is true, but the risk is getting slower and smaller and smaller the more we learn about that virus. Still, we have to try to reduce spray as much as possible, as we're all talking COVID-19 now. Who talks measles? Who talks tuberculosis? And we know they're infectious in our dental spray, right? And that's the bad news. So COVID-19 teaches us a lot about hygiene that we should have known for a long time. Maybe it enforces a little bit for us.
Thank you very much, and congratulations. The pictures are really, really amazing.
Thank you.
Changing a little bit the subject, when a prosthetic work arrives at your clinic from the dental lab, what measures are your team taking now, different from the measures that they were taking before? Something changed?
Now, it's important to understand that this virus is susceptible to every kind of disinfection, cleaning, and sterilization we've always been using in the past. And we've always been very meticulous about our hygiene. So no, nothing new to do.
Perfect. And a question now, as a dentist, a curiosity that I'm having talking with colleagues from around the globe these last months. Too much has been said about the time that will be spent for disinfecting a general dental practice consultation room between patients. Most of the colleagues in the last months were talking about an interval of 30 minutes, 30, between patients. Is this the reality your team is facing?
No, I mean, 30 is great. That's a lot. A good friend of mine, Dr. Miguel Stanley from Portugal, he founded a movement, it's called slow dentistry, 10 years ago. And they said that 10 minutes in between patients is so much time that you need to clean the room properly, to guide the patient out, to guide the next patient in, to disinfect yourself properly. And I think this slow dentistry approach is great here. So we really aim at 5 to 10 minutes time between patients with good outside air ventilation. And as this room cleaning is a very important thing again, I'll share some more slides if you're okay with that.
Of course.
So we're looking into room disinfection. That's a good friend of mine who works in Switzerland, and he shows the perfect setup for working. There's not much stuff lying around. Everything is disinfection ready. He wears perfect PPE. A lot has been said about fogging. We know that when we come to gaseous disinfection, the prerequisite for its success is effective manual cleaning. So you can fog on top if you wish, but as we know, our normal manual cleaning is absolutely efficient against that virus, as long as you're not working in aircraft, because here fogging is definitely superior to the normal swipes, then you're good, right? There's been lots of research on the first SARS coronavirus that the normal disinfectants work great, and same study I showed already, our regular disinfection, both hand sanitizing and swipes for surfaces, work absolutely fine on that virus. And there's literature back from the 1930s when there was shiploads of research on the Spanish flu pandemic that ventilation is extremely beneficial for our health here. So really nothing new, no need for 30 minutes. If you just take your time to properly clean your office, then you're good.
Perfect. This is good. This is good to know. And what measures are you and your team taking between one patient and another?
We swipe every surfaces. So at the beginning of the pandemic, we remembered what kind of hygiene we should have exercised always. But as you know, in so many offices, including ours, we sometimes disliked even the hygiene rules we had more than understanding them as what they are, our personal protection. So we reduced everything redundant from the operatories. We made sure we have flat surfaces, nothing standing around, all drawers closed, everything is disinfection ready in our offices, right? So when the patient leaves the room, we make sure the windows are open, that we get fresh air in. We swipe all the surfaces down with disinfectant swipes. We make sure everything's clean. We perform the regular hygiene on the dental unit. We make sure we disinfect our hands, because before the patient comes into the office and into the room, and after the patient leaves the room, we clean our hands. If we caused any splatter, we maybe remove the disposable gowns we were wearing, because if we have situations where we cause a lot of splatter, we'll add disposable gowns at the moment. If we had a splatter producing or spray producing procedure, we will take our goggles down, clean them with water and soap, and put them back on. And when this is done, this is like the slow dentistry, 5 to 10 minutes are over, and the next patient comes in.
And when the patient, for example, after the finishing of an implant surgery, any special new procedure for the patient while she or he is still in the consultation room after the end of the appointment?
Yeah, they are in there, and we make sure they understand everything, but we also make sure that as soon as it's not necessary anymore to have access to the oral cavity, that they're back on wearing masks. Because what we have to understand, we're talking dental sprays, we're talking dental aerosols, we're talking dental splatter, but You can have the cleanest procedure with the patient not even touching the oral cavity, and the patient coughs at you, and there you go, right?
No, that's for sure. Um, what safety measures should the dentist, his team, and patient take when coming back home from a dental clinic?
Now, I've been a maniac on that for all my life, right? Ever since I got a small daughter now, she's 8 months, I got even more meticulous when it comes to this. So for all my professional life, I did not come home and touch things right away. For all my professional life, the first thing after I come home before I touch anything is dispose of my clothes and shower. And in as probably all around the world, we never wear what we wear inside the operatories outside. So what we wear in the office stays in the office, is in the washing machine there, or laundry service, whatever is available to you guys. And now the new thing with COVID-19, but this is not that new. Ever when I operated on a tuberculosis patient, on an HIV positive patient, on a hepatitis C positive patient, on an active measles patient, whatever faced me, right? Because with our maxillofacial surgery thing, we see a lot of patients who have infectious diseases. So whenever I had this, always and forever, I disinfected all the areas that are exposed to the patient. So skin here, skin here. And this is a very, very ugly proceeding, but I basically fill my hands with alcoholic disinfecting agent, not alcohol, alcoholic disinfectant agent, right? And then I shower in that, make sure I clean all the surfaces. We require everybody in our office to we always did that, but we enforce it even more strictly today, not to wear the clothes they were wearing inside the office outside. Everybody has to wash their hands and their face and their neck thoroughly before leaving the office. And for us, now it's the rule for everybody, they also have to disinfect their face and their neck and their hands before they leave the office.
It's very nice. Well, Dr. Tröltzsch, could you give a final message to the colleagues all around the globe who are watching the video?
Uh, there's so many messages I want to give. Maybe the most important one: take it serious, but don't be afraid. You are superstars. Dentists are superstars of professional hygiene and protection of our team and our colleagues and our patients. That's probably one of the reasons why relatively few dentists were infected in China during the outbreak, whereas relatively more medical personnel were infected, because dentists were wearing PPE all the time anyway. This is the website where you can find all the downloads. So if you go to our website, and then it's in German, it's in Weiterbildung and downloads, and there you can find all the materials we have in English, some in Spanish, some in Dutch as well, of course also in German. It's very important that we understand how important our staff is to us. On the one side, it's just by working with us, they're always important, but furthermore, that during this crisis, when we look at suction techniques, how important a forehand suction is, how protective that is for our well-being and our health. So my biggest gratitude to our staff, but all dental staff members out there. From a medical perspective, and we don't have the time today to go into this too deeply, did this in other webinars. From a medical perspective, it's absolutely not beneficial to interrupt dentists to work. And if one does that, one has to have really strong reasons. And as we could see now in the field experiment in Germany and Sweden, looking at the infection rates of dentists during that pandemic, that is not detectable as far as I was told from the officials, it's obviously not necessary to close us down. Dentistry was never a safe profession. There's loads of biohazards in the oral cavity, and COVID-19 and SARS-CoV-2 is just a new player in that game that makes things a little bit more serious. But what we learned is that our standard protection and our standard measures protect us against this virus. So we just have to enforce strictly what we always should have known and done about basic biohygiene. In Germany, normal surgical masks for everyday use treatment for healthy patients are absolutely okay. Our rules are that for COVID-19 patients, we have to use N95 masks, FFP2 and 3 in Europe. Please consider your local regulations, as this is different in several countries. Some require N95 all the time. And also, it's very important to state that it's quite uncomfortable and has other issues to wear N95 all the time. There's loads of people I want to thank who picked up that fight with us from the beginning on, against that misunderstanding, against the wrong accusations that dentists are super spreaders of this disease, which is absolutely not true, and who fought from the beginning to make sure that the good reputation of dentists, which is unrightfully damaged by media coverage in many aspects, is restored as much as possible. We have to be careful, but knowing what we do, we can absolutely provide security for us and our team and our patients. And here's the email address that we have. If you have any questions or comments or need anything, just send us an email there and we'll try to answer as fast as possible. Yeah,
Very good
that was
news.
my final statement.
Yeah, very good news. Dr. Tröltzsch, once again, on behalf of Bego Implant Systems, thank you so much for accepting the invitation. It was very didactic interview you gave us. Thank you all for watching this presentation, and stay safe, stay healthy, and see you soon.
Thank you. Thanks for watching. Thanks for the invitation. See you soon somewhere. Thank you.
Bye bye.
Bye.